What's up, Einsteinatics? Another day, another opportunity to learn. We are going to focus all our brain cells in discovering the effects of lifestyle on the functions of the respiratory and circulatory systems. You're still with me, Sir Janus, saying let's learn and have fun. Gentle reminders before proceeding. Feel free to pause the video anytime to soak up the concepts. Pause the video, especially when answering the assessments or activities. You may use separate papers for your answers, or you may download the module provided by the link on the video description. And most important of all, please don't forget to subscribe so that you will be updated for more educational videos. Before we proceed, we are going to play a round of 4 pics and 1 word. Are you familiar with this game? If you're not, here's the mechanics. You will be given a set of 4 pictures and a set of words. You are going to guess what that word is based on the pictures. So, can you do it? Here's the first set of pictures. Can you guess what the word is? So this is a 6-letter word. The first and the last letter is already given. So for 30 seconds, guess what is the word based on the pictures. Okay, 5 seconds left. Okay, so the correct answer would be asthma. So who got it correct? Did everyone get it correct? Congratulations. On to the next set of pictures. This word is composed of 12 letters. So what do you think is the disease that is caused by the activities shown in the picture? So you have 15 seconds. 10 seconds left. 5 seconds. And time is up. The correct word is hypertension. So congratulations to those who got it correctly. The last set of pictures corresponds to a 6-letter word. What do you think would be the disease that will be brought upon by a lack of sleep, lack of rest, and poor nutrition? Okay. Clock is ticking. 5 seconds left. Okay, time's up. And the last set of pictures corresponds to the word anemia. So anyone guess it right? Congratulations. Now let's have a quick discussion about the activity that we've had. So, what idea is common in each set of pictures based on the activity? You might have observed that each set of pictures shows negative ways of living. Now, what are the negative lifestyles that are depicted in the pictures? You might have noticed that it depicts cigarette smoking, polluting the environment, eating unhealthy foods, drinking liquor, and sleep deprivation. If a person chooses to live an unhealthy lifestyle, what do you think are the effects on his or her body? This time, that's what we are going to focus on, the particular effects of a unhealthy lifestyle on the respiratory system. When we talk about respiratory disease, it means that these are the diseases that affects your airways and lungs caused by infection, smoking cigarettes, or by breathing in secondhand cigarette smoke, or other forces of air pollution. It is also known as pulmonary diseases. The first respiratory disease that can be caused by an unhealthy lifestyle is asthma. Asthma is defined as a condition when a person experiences difficulty in breathing as a result of the narrowing and swelling of the bronchial airways. Asthma has several triggers, such as allergies brought by pollens, dust, fumes, and certain foods. It also includes air pollutants and bacteria. The next respiratory disease is the most common of all, hence the name, the common cold. It is characterized by a disease affecting the upper respiratory tract. It is usually transmitted through airborne droplets or by indirect contact with infected secretions. The next respiratory disease, the pneumonia, is life-threatening and may even lead to death if not treated properly. It is characterized by an infection of the lungs caused by viruses and bacteria wherein the alveoli in the lungs are inflamed, and as a result, it becomes filled with liquid and pus, making it difficult for the lungs to transfer oxygen to the blood. The next type of disease is highly contagious and is commonly known as flu. This one attacks your throat, nose, and lungs and can spread directly through air droplets when people with flu sneeze, cough, or talk, and spread indirectly with objects contaminated with the virus. Hence, it is easily transmitted. The next type of disease brought about by an unhealthy lifestyle is known as bronchitis. Bronchitis, from the word itself, is characterized by the inflammation or swelling of the bronchial tube lining. Persons with this type of disease experiences breathing difficulty because of the mucus or phlegm which forms in the airways, thus obstructing the flow of oxygen into the lungs. Another highly communicable disease of the respiratory system is known as tuberculosis or TB. This is caused by Mycobacterium tuberculosis, which is an airborne disease that can spread from person to person through respiratory droplets via coughing and sneezing, which may cause to death if not treated early and properly. Usually, tuberculosis is brought about by excessive smoke. If you are going to look at the video on the right, that is an example of an infected lung with tuberculosis. Type of respiratory disease is, I think, one of the most feared disease at present. Coronavirus disease, or in short, COVID-19, is a serious global infectious disease caused by a new strain of coronavirus that infect both people and animals. The virus passes through the nose, sinuses, and throat and reaches the lungs. It is suspected that the main culprit for the disease are bats, which are transmitted through the consumption of bats or using bats as a food source. Virus or COVID-19 can spread the same way with other coronaviruses, mainly through person to person, by respiratory droplets and through contact with contaminated objects. So here's a quick graphic. As you can see, that is why by practicing social distancing and wearing a mask, it can help prevent the spread of coronavirus. So what are the symptoms of COVID-19? These may include the following: a cough, fever, chills, muscle pain, shortness of breath, sore throat, or the new loss or taste or smell. But some persons usually identified as asymptomatic, do not exhibit these symptoms, which raises the levels of danger because they might be spreading the disease without them knowing. After identifying the common respiratory disease brought about by unhealthy lifestyle, let us now proceed to the cardiovascular disease or the disease of the circulatory system. When we talk about circulatory diseases, this is usually characterized by an interruption, blockage, or diseases that affect how your heart or blood vessels pump blood. Diseases of the blood vessels and the heart are known as cardiovascular diseases. The first type of circulatory disease that is brought about by an unhealthy lifestyle is known as atherosclerosis. This one may result in a heart attack or stroke, which is caused by a blood clot, which now blocks the blood flow. This is a condition that develops when a substance called plaque builds up in the walls of the arteries, thus making it harder for blood to flow through. And this would now form the blood clot, which now in turn may cause heart attack or stroke. You're wondering, how does one acquire the condition atherosclerosis? Atherosclerosis is usually caused by smoking, eating food high in fats, excessive alcohol intake, diabetes, and increased stress. So if you do not want to have atherosclerosis, then you should avoid this unhealthy lifestyle. The next type of circulatory disease is known as stroke. Stroke is an effect of atherosclerosis. This occurs when it damages the brain when a blood vessel gets blocked or leaked out, usually from a blood clot. Some risk factors for stroke include smoking, high blood pressure, excessive alcohol intake, and diabetes. There are two types of stroke. The first one is what you call as the ischemic stroke, wherein a blood vessel is blocked, thus limiting the flow of oxygen through the brain. Another one is what you call as hemorrhagic stroke, wherein a part of a blood vessel bursts out, thus killing the brain cells within it. Another type of circulatory diseases usually raises the importance of a regular checkup. It is known as a silent killer since people with hypertension usually has no symptoms. The causes of this disease includes obesity, diabetes, lack of fruits and vegetables in the diet, and high salt intake. It is also a name for high blood pressure, which can lead to severe health complications such as stroke, visual problems, blood vessel damage, heart attack, and kidney failure. The normal highest reading for a blood pressure is usually at 120/80. Of atherosclerosis is heart attack. Based on what we have discussed earlier, if a blood clot forms on the brain, it may cause stroke. But when the blood clot develops on the heart, it may now cause a heart attack. The heart muscle supplied by the artery begins to die because of this one. The causes for the heart attack are atherosclerosis, diabetes, high blood pressure, and gender, which is more common among males. You might often hear this one, but some people often chose to ignore the message it brings. An ounce of prevention is worth a pound of cure. You might have been afraid with the diseases that we have presented, so you might be wondering, how does one prevent all that diseases? The first one is a surefire way in preventing those diseases is by having good nutrition, good sleep, and rest. This enhances your immune system that helps the body to resist infections and avoid eating high cholesterol and fatty foods. You don't want to be like this guy, right? One gauge, or a method of measurement to see whether you're healthy or not, is through body mass index or BMI. It aims to measure the relative amounts of fat and muscle in the body. By getting this one, usually by dividing the body mass in kilogram and the height, you are now going to determine your BMI. So you have here is some examples on how to determine the BMI of Gloria and Zach and their conclusions. Any number less than 20 is characterized as underweight, 20 to 25 normal, 25 to 30 is overweight, and more than 30 BMI is considered as obese. So we all know that obese people have an increased risk of arthritis, diabetes, and heart disease. And people who are underweight tend to have poor immune systems and often get ill or sick. Another way of preventing diseases is to never ever smoke. If you are going to be asked which picture shows the healthy lungs of a non-smoker and a smoker lungs, you could clearly see the difference, right? But some people still think that smoking is cool. The top 3 chemicals found on cigarettes are as follows: the carbon monoxide, tar, nicotine, but bear in mind that there are 7,000 different or several chemicals found on cigarettes. Carbon monoxide is a poisonous gas that reduces the amount of oxygen that red blood cells carry around the body. Tar, on the other hand, consists of tiny particles and is formed when tobacco smoke condenses. It is deposited in the lungs and coats the surface of the alveoli. Third one is nicotine, which is an addictive drug that affects the central nervous system. Its effect is that it increases the heart rate and narrows the blood vessels, causing high blood pressure. Another way of preventing diseases is to exercise regularly. In turn, it would improve the health of your lungs and heart. Aside from that, you can also garner these benefits such as development of your muscle, respiratory system and health, your pulse. It also increases bone density, raises your brain function, raises your red blood cells, perfect body shape, and you would be able to develop a strong heart. To prevent diseases, one must also observe strict personal hygiene, which means to always keep your body clean because, in turn, it will reduce the risk of catching any diseases. Another way of disease prevention, especially in times of pandemics, is to avoid crowds. Here is a demonstration or a simulation as to what would happen with no distancing and with social distancing. As you can see, with no distancing whatsoever, the disease is easily passed through from one person to the other. By doing or by avoiding large crowds, a person suffering from respiratory disease would avoid contamination. It is very important to take all the necessary precautions. So stay at home and just go out to get essential needs. So here are the ways of preventing COVID-19. Always wash your hands, use medical mask and sanitizer, avoid crowded places, stay at home, avoid contact with sick people, and do not touch eyes, nose, or mouth with unwashed hands. And sanitize, and making sure to sanitize. To sum this all up, if you want to live a healthy lifestyle, make sure that you consume healthy foods, develop or exercise your brain and your body. Through exercise, you are going to gain a healthy heart and a sound mind. Get enough sleep, and of course, by practicing good personal hygiene.